Hi, I'm Monique Godet, and I'll be talking to you about tobacco use in the United States. Tobacco use continues to be one of the 5 leading preventable causes of premature death in the United States, ending hundreds of thousands of lives each year. The purpose of this presentation is to show that there is a correlation between states that have policies discouraging the use of tobacco and smoking rates in that state. It's imperative that all stakeholders understand the importance of tobacco legislation and the supreme importance of lowering the smoking rate in each state, or even eliminating smoking altogether. Smoking is not only deleterious to a person's health, but it also costs taxpayers millions of dollars through increased healthcare expenditures. Cigarette smoking generates as much as $170 billion in annual healthcare spending in the United States, according to one study. The study also found that taxpayers bear 60% of the cost of smoking attributable diseases through publicly funded programs such as Medicare and Medicaid. Despite declines in the rates of smoking in recent years, the costs on society due to smoking have increased. Studies have found that there's a positive correlation between states that have policies discouraging the use of tobacco and lowered smoking rates in that state. The 2 main data sets that I used were the 2015 National Survey on Drug Use and Health and the Office on Smoking and Health's Interactive Data Dissemination Tool, OSH data. I also accessed the Campaign for Tobacco-Free Kids website, which offered excellent resources and interactive data visualization tools, including a tool that calculates the toll of tobacco in the United States and in each state, using data from the Centers for Disease Control, the CDC 2016 BRFSS online data. When evaluating data sets, the characteristics of quality information document that we got in class lists several characteristics that must be present in order to have quality information. The datasets constitute quality information because the information contained within both the 2015 National Survey on Drug Use and Health and the OSH data tool is timely, numerically quantifiable, rapidly and easily accessible, and in a convenient form for interpretation, classification, storage, retrieval, and updates. The National Survey data was designed to assist in estimating drug use and mental illness among non-institutionalized people who were 12 years and older in the United States. The OSH data tool was developed to present comprehensive tobacco prevention and control data in an online, easy-to-use, interactive data application to meet one of the Healthy People 2020 tobacco use objectives, TU-1.1, reduce the use of cigarette smoking by adults. The conclusion that I reached as I evaluated these data sets is that in the majority of states from 2011 to 2016, as tobacco education continues, tobacco use goes down steadily. I also found additional supporting information from additional sources in academic journals, as I'll refer to later on in the presentation. So moving on, we'll now discuss the relationships between the stakeholders and the healthcare issue of tobacco use. So as you can see in the center of the diagram, there are 3 main target populations for reducing tobacco use, and they are the heaviest users of tobacco. So these are the marginalized populations, people of low socioeconomic status, and people with lower levels of education. Each of these populations is vulnerable to increased targeting by the tobacco industry. There are also at least 10 stakeholders identified on this map. They're split into 2 groups, pro-tobacco, found on the left, and health advocates, found on the right. The most prominent pro-tobacco group, obviously, are the tobacco manufacturers. They drive the efforts of both the sales and the marketing efforts. Marketing efforts would include those involved in the design and production of retail displays, marketing materials, and ad campaigns. Sales tactics would include any messaging and ad placement geared toward increasing the messaging that's tailored toward those vulnerable targeted populations. On the opposite side, you'll find that public health campaigns drive the change on the side that advocates for health. These health advocates involve non-smoking groups, health educators, clinicians, and insurance companies that realize that sick people are not good business. Some of the ways they influence the target populations are through public health campaigns, state, federal, and local laws, and point-of-sale police enforcement. Moving on, we'll now cover what is highlighted in the infographic. So since this is obviously really difficult to see in this format, I cropped my infographic into 3 sections, which I'll now go over with you. As you can see, the total annual public and private healthcare expenditures caused by smoking exceed $170 billion, and more than 480,000 people die each year from smoking and exposure to secondhand smoke. The taxpayers' federal and state burden from smoking-caused government spending comes to a whopping $946 per household per year. Smoking causes $151 billion in dollars in productivity losses each year as well. The states with the highest smoking rate, with more than 25%, is West Virginia, and the lowest is Utah at 8%. And the national average you'll see there is 17.5%. During the research phase, I found that there were 4 main types of pro-tobacco legislation, and they are advertising, licensure, smoke-free indoor air, and youth access. The map on the left is the states that have 1, 2, 3, or all 4 types of legislation on the books. So the darker the state, the more legislation that is pro-tobacco. In this particular instance of pro-tobacco legislation versus other examples of anti-tobacco legislation, I didn't find a clear correlation between increased rates of smoking and higher rates of pro-tobacco legislation. Some ideas for the dissemination of anti-smoking information is to work to design and deliver public health interventions in schools and after-school programs, to conduct ad campaigns on mass media outlets such as TV, radio, and web, and to encourage grassroots social campaigns by the creation of shareable and educational materials. Illness and death due to tobacco is entirely preventable. By advocating for smoking cessation, we could see a country thriving with a healthier population and a more vibrant economy through systemic cost savings. Thank you so much for your time and attention. Here are my references, and thank you so much for a great class.